All right, this is my presentation on cardiac transplant for EXS 486. Oh, sorry. All right, what is a cardiac transplant? So, cardiac transplant is when someone obviously has a transplant of a heart from another person. The main reason that someone would get a cardiac transplant is if they're in late stage heart failure, where other treatments and other medications have not fixed the problem. So obviously they need a donor person for the heart, so that person must be considered brain dead, so they can still be alive, but so that has to happen. And a study from 2011 or from 2009 to 2011, 3 year post-transplant surgery success rate was almost 84%, which is pretty good for pretty intense surgery. All right, so why would someone need a heart transplant? One reason, heart failure due to a heart attack. They could have heart valve disease. They could have severe high blood pressure, which causes other issues. Can have infections of the hearts, and there are many other reasons, but those are the few main ones that someone would need a heart transplant. So heart failure, what is it? Heart failure is the inability for the heart to pump blood to the rest of the body. This can occur if the muscles in the heart are too weak or if they are damaged and cannot pump enough blood. So there's two differences there, either that they're too weak and can't pump the blood, or that they're damaged and can't pump the blood, or it can be a mix of both. Symptoms of heart failure, shortness of breath, fatigue with activity or while lying down, swelling in the legs, ankle, or feet, irregular heartbeat, heart attack, and chest pain are all symptoms of heart failure. And you can see in this picture here the two differences between a normal heart and a large heart from one that's going through heart failure. All right, so if you are qualified for a heart transplant, that means you've tried other options to fix your heart failure and things have not worked. A few minor steps before the fact, psychological evaluation, basically just to make sure that you're okay with going through this entire process. Blood tests, diagnostic evaluations, and other vaccines and things like that, because you're going to be on immunosuppressive drugs for the rest of your life after it. So you have to make sure your body's up to date for this. After that initial process is complete and everything is good and they have a donor of a heart, the patient will have surgery to replace their heart. And this image right here is a pretty simplified way of putting it. They're going to cut your inferior and superior vena cava. They're going to cut your aorta, cut your pulmonary artery out of your diseased heart, and they're going to put in a good heart and just seal those areas back up. So it seems pretty simple from that picture, but it's definitely still a very serious and complicated surgery. All right, so once you have the surgery, you'll be continuously in the hospital for a week to 2 weeks, continuously monitored. You'll have EKGs all over your body, your 12-lead EKG to make sure that your heart's beating correctly. You'll also be on a ventilator until your breathing is stable enough for you to breathe on your own. So some people that can happen faster than others. Some people might be on it for the entire 2 weeks. One interesting part about post-surgery, so for mucus in the lungs, it's obviously really bad, so they're going to make you take deep breaths and really forceful coughs. So you can imagine how hard that may be for someone that just had open heart surgery, but it's very important for post-surgery to keep mucus out of that area. You also may have an IV with different drugs in it to keep blood pressure in check just during those first couple weeks post. Once you're cleared by the doctor, you will go home. You'll still be continuously monitored. You'll have people come check in on you probably almost every day. And then a couple weeks after that, well, obviously you'll have like occupational therapists at first, and then after you'll have physical therapists and nurses who will help with breathing exercises and getting the chest moving again and just being comfortable with daily movements in life. You'll also work with nutritionists to assist with rehabilitation. That's super important as well. Obviously, you can't get this surgery and just go eat whatever you want for the immediate 2 weeks or a couple months after. You really have to watch what you're eating to make sure that your body works as well as it can. All right, so exercise testing for someone who has cardiac transplant would include one or all of these following. You could do a 6-minute walk with them if they can go that minute. You could also modify it to even 2 to 3 minutes. So that'd be an aerobic test. For strength, you can go 10 rep chest press. The area will be tender at first, but it is very important to get it moving again because once they're done the surgery and all stitched up and well, they should be able to move their arms and chest again with the amount of ease there. Individuals with a heart transplant will need to be monitored very closely before, during, and after any test. A few things with somebody with a heart transplant that'll be different than a normal person. So their resting heart rate will be elevated. Heart rate increases will be delayed. And blood pressure is also elevated at rest with a slight attenuated response to peak exercise. So it'll kind of lag your exercise. So you really want to make sure that you watch all of those variables throughout the exercise. Extended warm up and cool down are also needed just because of those attenuated heart rate responses. So when you warm up, it's going to take a little bit for your heart to start beating at the right pace. And then same thing with when you stop and cool down, you're going to have to really monitor to make sure that they're down into the right level. Individuals with cardiac transplant follow a similar exercise prescription to just with different cardiovascular disease or people with late-stage heart failure. So this is an interesting part. Because of a denervated myocardium, target heart rate will not be used for intensity. Instead, use subjective methods for intensity. That can be RPE, that can be a talk test, that can be a mix of those two together. But denervated myocardium is the lack of afferent nerves to different areas of the body. So your heart, since it's a transplanted heart, won't signal your body to go through other processes like if you had your normal heart in there. So this is the fit recommendations for aerobic from the ACSM book. So we'll have a minimum of 3 days a week, preferably up to 5 days a week for aerobic. We'll, again, use our RPE scale. We'll try and get up to the 11 to 14 range on the RPE on a 6 to 20 scale, or a talk test just to talk with them, see how they're going. Time for it, so we'll progressively increase from 20 to 60 minutes. And different aerobic activities, treadmill, free walking, stationary cycling. We can even go things with a little more like movement in them, like step tests, forward back, lateral step tests, things like that. Can really use a wide range and a wide variety, mix of things, just as long as we keep monitoring everything going on with them. Here's fit recommendations for resistance. 1 to 2 non-consecutive days. Begin at 40% 1 RM. We'll gradually go up to 70. 1 to 2 sets, 10 to 15 reps for major muscle groups. We do machines, dumbbells, elastic bands, body weights. Flexibility is third on this. Frequency, 2 to 3 days a week. So you hold to the point of slight tension or tightness, 10 to 30 seconds. 2 to 4 reps each. Static, dynamic, PNF all work for flexibility. To different responses to heart rate. Obviously, your heart rate will be elevated. This makes heart rate sense difficult. RPE is going to be used. Your heart responses will be attenuated. So heart rate relies on circulating catecholamines. So there will be a lower peak heart rate. Stroke volume will be lower than age predicted, and cardiac output will also be less. VO2 max will mostly be lower. Modified test will be used to determine this. We most likely won't get this person up to their VO2 max, but if we were anywhere close to it, it would be lower. All right, so this is my case study here. So I have a 50-year-old male. He was in late-stage heart failure for the past 2 years. He tried other medical treatments, other exercising, things like that. Didn't work to control his symptoms. He was a candidate for cardiac transplant, so they went through with that. He completed his beginning stages. So this is like the 2 to 6 weeks post-surgery. He completed that with his occupational therapist, and now needs higher intensity aerobic and resistance work, and he's 8 months post surgery. So he's been cleared by his doctor to do so. So he's all good. So he comes to us with just a need for more aerobic and resistance training. So have him do. I'd put him on a modified Bruce treadmill just to see what speed we can get him for. A target heart rate max will be set by your resting, so we'll try and get his resting rate plus 20 or 30 beats per minute, or RPE 14 to 17. Now, if their heart rate can get higher than that resting plus 20 to 30, then we'll use more of our RPE, or we could use a mix of both. You can also modified step test him to see how he works aerobically. Continue to just monitor all those factors. For exercise testing for strength, we'll get a 10 rep chest press, monitor blood pressure before and after. That's very important. Also 14 to 17 for max exertion. We can get them on a leg press. Exercise prescription. During exercise, only RPE or talk test will be used. Heart rate will not be used. So on a treadmill, for 30 minutes, speed and grade based on RPE. So we can start easy at 2.2 at no incline. They can also bike if they want to, but then we can slowly increase that depending on the RPE. Resistance will be very important because of immunosuppressive drugs in the musculoskeletal system. Should be performed regularly for all muscle groups beginning at 40%, 1 RM for upper body, 50% for lower, progress all the way up to 70%, 1 to 2 reps, 10 to 15s. You can do chest press, seated rows, leg press, cable pushdowns, leg extensions. We can do things with our cables, with our bands. We can incorporate a lot of different movements for these people. So you really shouldn't hold back on any of it. It just really depends on the different intensities for them. And that is that. I hope you enjoyed.